Hello, we're from Group 11, and this is.
Hey, my name is Maria Justinovita Chawanayu.
My name is Yoel Octavian Sipayung.
And my name is Arcela Reva Anfet. And this is opportunity. We would love to talk about cancer patient handover.
Enjoy!
What is the definition of cancer patient handover? Cancer patient handover is a process that refers to the transfer responsibility from one healthcare division to another for a cancer patient. Handover is one of the important healthcare service. It is because it can affect the customer satisfaction. The customer satisfaction can include convenience, health, and also safety. This is the situation that we found. The ward nurse hands over a cancer patient to the surgery department for mastectomies. The patient's condition is stable, but she's nervous and scared. On that situation, we know that the patient was not satisfied. And also, we need to address issues that might affect customer satisfaction. Based on that situation, we would like to use F1 pit stop as benchmark. In this discussion, we analyze the similarity and the difference between patient handover and F1 pit stop, especially cancer patient handover in that situation that I told. If the F1 pit stop has the better things, the patient handover need to implement the best practice from F1 pit stop. What is the definition of F1 pit stop? A pit stop in Formula One is a part of the race to do necessary adjustment and repairs their car to improve the performance. So, we would like to compare the background identification between cancer patient handover and F1 pit stop. The background identification on cancer patient handover is the critical information conveyed must be concisely and accurate by healthcare professional. It is to ensure continuity of care and patient safety. On F1 pit stop, the background identification is every action is planned and executed with precision. The action that they do is to minimize the time lost and optimize the car's performance in a race. About the background identification, we found a similarity, and it is precision.
Okay, now we're talking about communication between ward nurse and the patient. When the patient gonna be like scared or nervous, it's because the patient gonna surgical in the hospital. So communication is important between ward nurse and the patient. When a nurse hand over a patient to the surgical department for a mastectomy, effective communication is crucial. So step one, the ward nurse can inform the patient. The nurse should explain why the patient for the transfer and what the patient expect in the surgical department. This can help the patient to calm down and be good. And step two, communication with the surgical team. Like the nurse should provide the surgical team with a detailed report of the patient condition. And three, provide emotional support. The nurse can offer reassurance and empathy to the patient. And four, the nurse can offer reassurance and empathy to the patient, acknowledging their feelings and offering words of encouragement. Next, we're talking about communication on pit stop situation. The first one is use pre-planned procedure. This can include specific roles for each team's member and a clear order of operation. And the second is use hand signals. For example, time's up can indicate that everything is okay. And the third, effective, compact and immediately occupies a place according to the part being worked on. The next, we're talking about patient satisfaction. The first, the nurse can also encourage the patient to ask questions and express their concern. Additionally, the nurse can provide resources, brochure, videos, or support groups that provide information about masectomy and recovery. And the second, overall patient satisfaction is influenced by the quality of care they receive, effective communication, and emotional support. By providing their elements, the ward nurse can help ensure a positive experience for the patient during the handover to the surgical department. Next is pit stop crew satisfaction. How the satisfaction of pit stop crew? The first is when the pit stop crew has successfully completed the task of their respective part. And the second is there are no problems or long delays when stabilizing the car, so that it continues to perform optimally.
This the service user in the case. The first one, the service provider ensures that the operating room is properly equipped and prepared for surgery, including installing instrument, setting up monitoring equipment, and ensuring that all necessary equipment is available. The second one, the provider can perform an thorough assessment of patient's medical history, current health and status, and any pre-existing conditions. This assessment helps identify potential risks that need to be addressed before surgery. This is the service user in F1 pit stop. The first one, the service F1 pit stop, a service user can refer to an area client that can quickly access a particular service or research. For example, in curtain time slot, where there is a special need to receive maintenance on a racing car. And next, the second one for service user in F1 pit stop. In social service, it may be a temporary facility or point of service to which individuals provide immediate assistance or research. This could include circuit location and counseling centers for vessels in crisis. And next, the third in service user in F1 pit stop. A pit stop may refer to a specific area where participants can access various service or facilities. And next, the 4 in service user F1 pit stop. Pit stop can refer to a specific service use who can be a driver or the site team member working closely with the pit crew to ensure the pit stop is smooth and efficient for participants.